Rabies update. It is an RNA virus and more prevalent in the poor nations in Africa and Asia. Virtually, it is eradicated from the America and Europe, West Europe, because by dint of the immunization of the dog and other domestic canine animals who are the reservoirs, who are the transmitters. Basically, the disease is prevalent in 90% of the transmitted by 90% of the dog bite, and 10% by the others, like the your jackals, raccoon dogs, the mongoose, and other can bats. The important cause of important elements in transmission. In less than 1% of the flying bats has carried these things, and more than 8% of the down bats has the disease. It is transmitted from their saliva by a bite, and face is highly innervated area. Biting in the face is more likely now to have more furious and severe sort of rabies encephalitis. So axon transmission is one axon is said to be crossed by the virus by 12 hours. So thereby, so the virus reaching to the bite site to the brain and spinal cord depends upon the distance of the bite. Thereby, the it's important. There is encephalitis, there is myelitis, and there is formation of negripotis. That is the your uh, um, clumped sort of the nucleocapsid of the rabies virus in brain biopsy and other nerve tissue and other biopsies. Diagnostic incubation period is 1 to 3 months basically because of the distance involved, and then severe disease in the head and face, it takes only 5 days. In the other cases, in the distal bite, that take little bit longer time, maybe months. So hydrophobia is by far the commonest presentation. Might be aerophobia. So because of the contraction of the pharyngeal muscles, neck muscles, and diaphragm. So child is little bit agitated. The autonomic dysfunction is common, but the cognition, it remains clear. A person dying with full consciousness, understanding everything, embracing death is how pathetic it is. So this is an important humanitarian point of view, and cardiac arrest occurs in 25% of cases. Brain death and the neuronal damage and sequelae is very common. So decortication and then other things are also possible, and almost 100% fatal in good amount of places, at least in those cases where it has higher prevalence in the resource poor nations. So apart from that, differentially, this sort of presentations, we can think you should have differentials like the Guillain-Barré syndrome, other encephalitis or different viral and bacterial, and conversion reaction, tetanus, drug abuse. They appear to be of clinically. They appear like rabies. Diagnosis, it is confirmed the PCR RNA detection, rabies RNA detection, of the 90% sensitive from the skin, from the saliva, and other tissues, maybe brain biopsy. Antigen detection from the same site, and antibody in the CSF and in the serum. So, and then mind it, the person vaccinated, immunized against the this rabies may have antibody in the serum. Treatment of those cases very difficult, very high fatal disease, almost said to be universally fatal. So in 90s to 97 something, 79 or to onwards, there are few survivors, 77, 79 survivors, and some centers is 7 out of 10 has. The survivors a little bit of have crossed and difficult neurological sequelae. One report says 7 out of 10 neurological survivors has the severe neurological handicap. So it's important. The treatment of with antiviral PV is not that effective. There are people tried with various antivirals with with unsuccessful outcome. Prevention by vaccination of the domestic animals, as because the America and the Europe, they eliminated the disease from their places by vaccinating all domestic the dogs and others canines. So it is important way of controlling the fatality, and fertility control of the dog is also and others is also important way. Post exposure prophylaxis, despite everything there can be bite, and then by an vaccinated dog, and what you will do over here. So medical, it is in medical urgency, may not be emergency, but it is an urgency. So contacts, even the physical contacts with the these animals can have the disease, especially the bats. you know uh, 10 days incubation quarantine, 10 days observation of the animal is said to be a way to understand the disease. But sitting idle is not wise, and then cleaning the wound debridement, and your antibiotic if this is lacerated and infected wound, tetanus prophylaxis, and finally the important disease modifier over here, the human rabies immunoglobulin, HRIG. It is essential to give those things. But it is very expensive, not available in the resource poor nations. So it's a, and then passive immunization for time being can be given with the rabies immunoglobulin, and surround infiltrating this immunoglobulin around the wound. And finally, the things available over here and many other resource pools, the inactivated vaccines, the Rabivat, Rabipur, Emovax, and others at day 0, 3, 7, and 21. So ultimately, the ultimate outcome, if you vaccinate these things with the bite cases and other exposure, you can have the less amount of rabies. And pre-exposure prophylaxis can be practiced in the highly susceptible populations, like the veterinarians and the lab workings with these agents, and then and then immunoglobulins and other preparatory sort of things, and people traveling in the endemic zone they also can have the pre-exposure prophylaxis with 0, 7, 2 doses.